Mm-hmm.
So, Nova, your question for me is about anesthesia. So the others joining are radiologists and I think and
Yes.
Nova is the only anesthetist, or we call it anesthesia, anesthesia.
Yes.
Lyrica is already, I think, if I'm correct, Lyrica, you already tried to apply via the assessment pathway. Is that correct, Lyrica? Yes. So, Lyrica, where if you don't mind just chatting with us, because Nova can learn from you of what you've done in terms of getting assessment or applying for the assessment and getting all your AMC requirements submitted. Papers are still evaluation by RANSA. So you submitted everything. That's cool. And you're just waiting for the assessment. So Nova, question more is about how to apply for fellowship, isn't it?
Yes, Doc.
Okay. So
Yes
before
po,
we
Doc.
go to that, I'll tell you background. I think you have already a background of what I did, what I've gone through. So basically, I in 2004, I finished, 2004, I finished my radiology training in Medical City. And my goal was to apply for fellowship all over the world, and including Australia, in interventional radiologists, because hello, because there's no interventional radiology fellowship in the Philippines. And there's only two interventional radiologists in the Philippines at that time. And my goal was to do 1 year of fellowship and come back to the Philippines, go back to Medical City, and aspiring to be the first female interventional radiologist. So after applying to all, I did not have any guidance. I was just being proactive and very intuitive and very resourceful. I just went online for 2 or 3 months. I just sat online and emailed and sent my CV, an application letter to all training hospitals in Australia and all over the world, including America. I even applied to be a radiographer in America. But after with prayers answered, I got an offer to do a fellowship here in Perth, in Western Australia, Sir Charles Gardner Hospital, to do a 1-year fellowship training. So for them to sponsor, not really sponsor, but to sponsor my visa, because they need to. What I mean by sponsor visa is to for them to apply for my visa and for my APRA registration, which is the medical board registration. I need to supply them all the requirements. Number one would be the IELTS exam. So dapat ang IELTS exam lahat 7. There are other English exams that I know of, PTE, is it? And OET. So that's another option. But the ang generally IELTS I think PTE is still okay. I don't know whether may PTE dyan at saka OET. I think PTE now ang ginagamit mostly ng mga medical related career, kasi I think sabi nila mas madali daw. So I cannot say anything about it because I did not do it. What I've done was IELTS at saka OET. OET also was easier because medical related lahat ng mga exam. So you just need to check the college registration o yung APRA registration, I think if you're in the chat group of the medics Facebook group, you will see there yung mga requirements ng APRA. So, yun ang ginawa ko. Pinasa ko, English exam sinubmit ko at saka lahat na requirements including police clearance, ano pa, CV, lahat ng anong i-require nila, submit ko. Tapos sila ang nag-apply, sila ang nagbigay sa akin ng letter of employment for me to apply for the medical training visa. I don't know if there is, if that is still existing or whether they changed the medical training visa. Pero yun ang ako ang nag-apply na sarili ko. I never used an agent. So, because mas malaki ang babayaran mo sa agent kaysa sa lahat ng gagastusin mo. But to each his own. But for me and for the people that I've helped, we did not use an agent because you can go to Australia without any help. You can do it on your own. But yes, I'm happy to guide you kung may mga questions kayo. So, after that, after na masubmit ko yung requirements, ang medical board, it does take 3 to 6 months or so to process yung medical registration, because you need to have a provider number to practice as a doctor or even a junior doctor or trainee in Australia. So matagal ang process. So siguro it took me maybe more than 6 months para bago ako makaalis dito sa from the Philippines. And so after that, walang subsidy ang hospital with regards to relocation and everything. Sa akin lahat out-of-pocket expenses. They only supplied the certificate in employment, and then I submitted everything sa visa para makuha ko yung visa. Nung na-approve yung visa ko, eventually, dun lang nag-book ako ng flight and everything, and then I arrived here in January 2005, so I'm celebrating this month my anniversary here in Australia. So at this stage, meron ba kayong mga question?
Doc, so I have a question, because so my plan is to really just have fellowship or advanced training in Australia, so I have no intent of actually migrating there.
That's okay.
So do I really need to take the AMC? No need, diba? No need.
So if you're only planning to do fellowship, kasi lahat ng ang kagandahan dito sa Australia, they are really advocating trainees from all over the world. Majority of their trainees na nagfe-fellow are from the UK, Sri Lanka, India, lahat ng Commonwealth countries, they come here. UK, EU, they all come here to train, and then during the fellowship, they will decide whether they want to stay or not, or go back to the, I don't know what's the percentage, but I've met a lot of fellows coming from the UK, London, Ireland, Scotland, all over the world, who are really just coming in for training, and then eventually if they want to stay, they have to sit the exam, obviously. So that's what I did, kasi after, my plan was to go back to the Philippines after my training, and I did not plan to relocate in Australia, but in March of 2005, I met my Filipino husband, we got married, and stayed. So my dream was not my destiny. So ibang aking destiny na binigay ni Lord. So I'm really grateful na I made that decision to stay, because I did not imagine that, I cannot imagine what I've achieved now and what mga blessings na receive ko of 18 years here in Australia. I'm so really grateful. So yeah. So to answer again your question, kung gusto mo lang mag-fellowship, there's many avenues to do that. The number one would be the paid, meaning salaried or salaried fellowship. You have to really apply and proactive and going to the sinan ko sa yung website, di ba?
For yung
Anesthesia.
Perth? Yes, Doc.
Yung College of Anesthesiologists.
Yes, Doc, the one in Perth.
No, there's a Australia one. There's the one in Perth, but that's the training position. And so you have to go to Google Royal College Australian New Zealand College of Anesthesia.
Okay. Yes,
Tapos doon
Doc.
sa like in radiology, you go to Royal Australian New Zealand College of Radiology. You go to the college website, go to their IMG or Immigrant Doctors tab, and then they will tell you what to do. And then for training position, fellowship, nandun may mga job advertisement sila na pinopost lagi. And they advertise 2 years in advance. So if you want to do fellowship next year, I don't think you'll get it because it's usually closed. They usually have someone already. They advertise 2 or 3 years in advance, but that's okay. You can still submit individual hospitals because sometimes the fellows doesn't show up or may obstacles or whatever reason. So if it's for you, it will be for you, it will happen. It's usually it will be challenging kasi ang kalaban mo sa fellowship positions will be the local trainees here in Australia plus yung mga overseas.
Okay.
So that's number one route, but yeah, you have to, parang sometimes I can tell you it's like suntok sa buwan because when after my 1 year of fellowship here, I couldn't find a job for 2 years. Nandito na ako kalaban ko kasi mga local trainees at saka walang opening. Ang merong opening lang is after 2 years pa. Naswertehan ko lang na after ko ipanganak yung first ko, nagkaroon ng opening na offer sa akin. So naswertehan ko lang because I was here and they already know me and they asked me if I'm available. I just said yes, of course. So yeah. Pero again, hindi pa ako nag-a-apply noon for, I was already aspiring to get qualified here, but I just needed a job so I can start the process of my qualifications to sit the exam. Because every fellow or trainee needs to sit the exam to be a qualified radiologist or a qualified specialist here in Australia. Ang goal mo is not to do the AMC exam. Ang goal mo is to do the part 2 exam. I don't know ano yung parts ng anesthesia, pero sa radiology, ang goal mo is to sit the part 2 exam. Tapos yung kaya you go straight to specialist pathway if you do decide to stay. But going back to your question, the other way for you to get training here, ganito ang ginawa ng friend ko na nuclear med. I helped him find a hospital to do an observership. So nag-observership siya for 6 months and he did not plan to stay. So this observership is all out of your pocket. But you need to find someone who would say yes, they will train you. He was just sit in lang siya. Lalo na kung procedural, so magsi-sit in ka. So okay, yun ang ginawa niya, nag-sit in lang siya sa ang ginawa niyang training is PET-CT for 6 months. And then bumalik siya sa Pilipinas. I don't know whether you know him. It's Raymond Conlu. And now he's got multiple PET-CT centers in Manila and Baybay. He set up his own center. So that's another option. Pain management is really big here in Australia. It's very much in demand. At yan ang bread and butter ng mga anesthetists. Actually, yan din ang bread and butter ng radiologist. So I do a lot of MSK injections here. Very much in demand siya dito. Hindi ka mawala ng pasyente dito. Marami kang everyday. During my consultant job, my first job as a consultant, I was traveling all over Western Australia, in different parts of Western Australia, remote hospitals, to just do steroid injections. Masaya
Doc,
yun.
during in that page that you sent me, yung ANSCA.
Yes.
That page, because on that because I pressed the SIMG, yung specialist IMG, International Medical Graduates. So first is they wanted you to get a self-assessment tool, and one of those questions there was your specialist training program undertaken in a comparable health system? So I'm not sure what to answer.
Ilalagay mo kasi ang training natin is really not comparable to Australia, but it can work. We can work on it. It can be equivalent. Kaya yung nakalagay doon, or equivalent. So yes, you are equivalent. Sila mag-a-assess sa'yo. Ititik mo pa rin yun kasi or equivalent eh. Kasi paano ako nakapunta dito?
I think that's because I answered it one time, and then I think I failed the self-assessment tool because I answered no on that question.
No, pagka nakalagay or equivalent, you can tick the box because we are equivalent and we can work towards being comparable. Hindi ka talaga makakapasok pag tinik mo yung no. So you have to, kaya ka nga pupunta sa Australia is to train and to be at par with the rest.
Okay, Doc.
Sorry, may mga question. Lyrica, I think in my case, Doc, that is the work of the RANSAP, all right, to declare if it's comparable. Correct. So, Lyrica, so yun yung another, sagutin ko yung question mo, Lyrica, tapusin ko lang si Nova. So, yun ang gagawin mo, observership, or even a short-term observership. If the hospital will pay you, that's great, but less likely. But you can still do 3 months or 6 months or whatever, or in hospital. So mag-apply ka sa mga hospital, or you can go to a private center. I don't know anyone. Do you know anyone anesthetist overseas in Australia?
A private
doctor specialist?
I already told one of my consultants, because I think they have a former colleague who's in Sydney at the moment. So I'll try to follow up on that, Doc.
Yan ang another option mo. You just go to a private center with one-on-one or whatever in a private group, practice, you sit down and just ask to do observership.
Okay.
Yan ang another option mo. And then you will apply, I think it will be a visitor's visa for that.
Okay.
I don't think
Visitor's
the hospital or the private center will sponsor you at all. But yeah, it will be your out of pocket, and usually pag mag-apply ka naman ng visitors, they will give you 3 months eh. Unless you have a relative here, so it's easier. Kung may relative ka dito, you can stay longer.
I have a relative though.
So yeah, then you can stay longer. So yun ang mga options mo. Marami kang options. So it's really up to you what you want. But yeah, you will try everything, and then you aiming to do a paid one. But while waiting for the paid fellowship, you're still going to email all possible private and public hospital and private centers or consultants to train you to do observership. Kasi mas madali kang makakakuha ng paid one pag nandito ka na at you get to know people. Like in the Philippines, hate to say, it's now who you know as well. Who will give you recommendations. So, I'm going to answer now,
Thank you,
Lyrica. No worries. Si Lyrica, ano nga yung question mo? So, yeah. May mga natulungan na akong mga Filipino radiologists here na nag-apply na nagpa-assess. So, nung pa-assess siya, ang sabi sa kanya, she's comparable. Ano siya? Ka-graduate lang niya ng St. Luke's. At after ng kanyang, kasi nung in-interview ako, sabi sa akin hindi daw comparable, so I have to train 18 months pa. Yung 18 months ko, it took me maybe more than 3 or 4 years to finish the training, only because I'm already here and I'm just waiting to sit the exam. Nagpe-prepare kasi ako to study sa exam. So it took me more than that. So basically, yung friend ko, from St. Luke's, she got assessed, and assessment sa kanya, you're comparable. So she's very lucky. She doesn't need to do training. But because we're Filipinos, we don't know what we don't know. We feel that we're not comparable, which is, it's okay. So she said to me, oh, I still need to do some training before I sit the exam because I'm not confident to sit the exam, which is fair. So I helped her find a job. It's not easy. It took her, again, 1 to 2 years to find a training position. So sabi, ganun din sinabi ko sa kanya, email niya lahat. And after 1 to 2 years, nakakuha siya ng unaccredited training positions sa Victoria. She did that for a few months. Her family is in Perth, so for her to go to Victoria, to Melbourne, she has to have her mom come over here in Perth to look after her kids because may baby siya noon. And so tas habang nagtitrain siya sa Melbourne, so sa Victoria. Tas after noon, nakakuha siya ng accredited fellowship sa isang major hospital dito. And then after her training doon siya nagsit na exam. Pumasa na siya ng exam. So, 1 take lang yung exam niya, done, finished. So, yeah. So, success story siya. Is there a high chance na maging comparable if nag-fail? Yes. At saka, pagka meron kang fellowship, yes. At saka kung meron kang marami kang CPD, check mo yung CPD, i-google mo yung Radiopedia. May mga online courses ang Radiopedia. Kasi very big Radiopedia is based in Australia, so very big sila sa mga CPDs, sa mga online webinars and everything. So meron akong isa din na tinutulungan from Nigeria. She's also in Melbourne. It took maybe more than 12 months yung processing ng college assessment niya kasi nagka-COVID, di ba? Everything, the college really closed down during the 3-year pandemic. So it's only last year na nakuha siya ng assessment sa college after waiting for more than 12 months. Ang sabi sa kanya, huge ang backlog, Lyrica, kaya ilang months ka na naghihintay? Okay. Lyrican, are you still there? Ilang months ka na naghihintay sa college assessment mo? They returned my application po because of CPD. So yeah. So you're doing this Radiopedia CPD now, di ba? Kamusta yung Radiopedia CPD mo? Yun lang ang kailangan mo? Ilang points ang kailangan mo daw? Okay. So, yeah, I don't know. Ilang points, hindi ko alam kung ilang points. So yun lang ang kulang. Sana, bakit hindi mo in-email? Yeah, you need to email them and ask them so you know what to say. And then if you have time, they have a call center if you can call as well, because you cannot just wait for emails, because sa college, any college, mga admin people, they only work part-time. And they are already bombarded with many email inquiries. So you really need to be proactive, email, follow up, tawag if you can. And don't wait for a month or more than 2 weeks for reply. Be proactive, because if you don't hear from them, it's either you'll just either wait until whatever. So you really need to be proactive and just doing follow up. Maybe mahiya ka dahil baka makulitan, pero there's nothing to lose if you don't ask, right? Kailangan maging proactive. So, may mga questions pa ba kayo na gustong malaman? It would be nice to hear anyone, at least, kaysa, alam mo, I'm ophthalmologically challenged. I don't have my reading glasses, so reading the chats, that can be challenging for me. So it'd be nice if I can hear your voices or even see you. Is there any more information you need from me?
Hi, ma'am.
Hi. Hi, radiology.
Hi, it's Ruby Ann po, ma'am.
Hi, Ruby.
Yes, ma'am. It's Ruby Ann po, ma'am. Sorry, wasn't able to change my name.
That's okay.
Yes, ma'am. I would like to ask mo about the STT pathway for specialists. I read about it in FB group, the short-term training for specialists.
So yun yung
like,
observership na sinasabi ko.
Okay, ma'am.
So baka maputol tayo. Pag naputol tayo, mapuputol tayo in 1 minute. Just go back in again, okay?
Yes, ma'am. So for observership, ma'am, it's not counted as a work experience.
Yes, of course. Of course, any training inside in Australia, overseas, or any CPD conferences you do in the Philippines, outside the Philippines, considered CPD and training yun. Counted lahat yun. So whether you do it online as well, it's always counted. Mapuputol na tayo in 20 seconds. Oh, no, it's not. 9 minutes pa pala. Okay. Yeah, continue.
I'm sorry, ma'am. I lagged in late, so I'm not
That's
sure
okay.
if you discussed this. If you
Yes.
discussed this already. After you do your English assessment exam, you submitted your credentials in EPIC for verification, or after you verified your
Yes.
credentials, what's the next step, ma'am, for us radiologists?
So you have many options. So fellowship position, mag-a-apply ka all over Australia. Dun sa college website, pupunta ka dun sa mga hospital list or fellowship position list and jobs advertisement nila. Mag-a-apply ka sa lahat. Ganitong ginawa ko kasi na nag-apply ako all over the world, including all hospitals in Australia for a fellowship position, and they always advertise 2 years in advance, because 1 year advance they already filled up. And ang mga fellows nila are coming from all over the world, especially in Commonwealth countries, including UK, EU, Sri Lanka, India, Malaysia. So marami kang kalaban. Apart from local trainees, kalaban mo yung mga other countries. So I told them na it can be like suntok sa buwan pag nag-a-apply ng fellowship dito, pero nothing is impossible with the Lord. Nakakuha ako ng fellowship dito 18 years ago. I'm celebrating my 18-year anniversary here today. Yes. Or in January now, in this month. So yeah. Tapos fellowship, observership. So yeah. Or if you want to do a short-term observership here, you can do it as well. But everything is all out of your pocket. You can do it here if you want. I can give you an invitation. Letter of invitation. For
Does
you
it
and
mean, ma'am, that
Lyrica,
after
whoever.
we, yes, ma'am, after we, so we can, at that point, ma'am, we can already we can start looking for jobs in Australia for fellowship training. Even if they advertise job positions for, usually kasi ma'am, what I read is they're looking for fellows na Ranzor
Or equivalent.
or who,
Or
yes,
equivalent.
or equivalent po, ma'am.
You're
So,
the equivalent.
equivalent
That's
po
how
ba,
I
ma'am?
got in.
Ah,
That's how other people, other
equi-
fellows got in from the UK because they are not Ranza. Lahat ng mga fellows coming from all over the world are not Ranza. The only time you will get your Ranza if
yes,
you apply for the college assessment and sit the exam. But lahat ng fellows dito na pumapasok are not Ranza. So yung chances mo to get in is similar to the people from all over the world.
From outside. Okay.
Correct.
Thank you, ma'am.
So yeah, if you want to, yeah, this is just me talking out loud. If you want to do observership here, how many weeks or months, it's up to you. You apply for your visitor visa, and then I can give you letter of invitation to observe here if you want, or not. You don't need it. You can just apply for a visitor's visa, and then come here, and then observe. And I can give you CPD certificates. Any other question?
Doc, so in conclusion, so me that who's really who's not interested in migrating there. So
Yes.
basically my options are, first is either I go there and probably
Go on
like ask for an
holiday.
invitation,
Yeah.
yes, on a holiday, and apply directly or go directly into a private hospital or whatever, whichever
public,
hospital who can offer an
Yep.
yes, that one. Or
Kung may kakilala kang kamag-anak at may kakilala or mga colleagues mo, mga boss mo, may kakilala, and they can ask a favor from them to do a observership for you.
do
That'd
you
be
think
great.
there's a high there's a high likelihood that I can, like, there's a high chance that I can be accepted in a way, like
I tell you, compared to
as a visitor.
I'll tell you what is so humbling about consultants here in Australia. They're very, very accommodating, and they're very not apart from very professional, very accommodating and very helpful. And they share a lot of knowledge. They teach a lot. They love teaching. They are very supportive. Walang buljakan dito. It's very humbling for them na they really make time to teach you per bono. You just need to meet the right people. I do have medical students who come to me to observe me for the past 3 years now, and I do it per bono.
Okay, Doc.
So it's my way of giving back. So lahat ng ginawa ko dito, I did not have any help. Lahat is all my being resourceful and just being proactive and lots of prayers. Do they recognize completed fellowship trainings here in the nabasa ko na ba to? Oo, they recognize. Pero I don't know about Epic. Di ba, Lyrica, hindi naman na verify yung iba mong training sa Epic? Oo, yun lang ano natin. Yun lang medical degree natin ang inano nila, in-acknowledge. Yung aking fellowship, kasi it's I did my fellowship interventional radiology and breast imaging. Yun, na-accredit yun ng na-recognize yun ng EPIC. Yung
Hi,
CT,
ma'am.
MRI, ultrasound, I'm not sure. Okay, yes? Who's asking?
Regarding po the EPIC,
Yes.
Rubian po, ma'am. Sorry, I have to change my.
Yeah.
Regarding ma'am the EPIC credentials, we should include our medical diploma, residency training certificate, ma'am, or the diplomate certification.
Lahat ng
ma'am.
certificate mo, but Lyrica can probably answer that. Alam ko lahat ng kung ano nakalagay. Nasa EPIC naman yung yung listahan, di ba? Lahat ng masasubmit mo, even if you did the other fellowships. So, included doctor and
Yes, ma'am.
then so in-include niya yung medical doctor of medicine certificate, residency certificates, at saka diplomate.
All
So,
right,
lahat.
thank you.
So, any other question pa? We have 1 minute left. And then if you need, just direct message me kung gusto nyo, pang may mga question pa kayo. If you want to do another Zoom meeting, let me know. But yeah, this will be uploaded in YouTube. I can send you the link and you can share it to anyone who will be interested. Meron pa ba kayong mga question?
As of now, wala pa, Doc. Wala na, Doc.
All right. Thank you for your interest. Let me know how I can, Doc, if ever magpa-holiday, can do observership. Yes. So, Lyric